Start recording. Stop record. Voiceover off.
Hi guys, welcome back to Bubbleburst. Today we're going to be going over something medically related. Today I'm going to be teaching you how to draw blood using vacuum tainer method. For those of you who haven't seen yet, I don't know if you've seen because I haven't posted any videos on it. However, I do have a patient that I'll be demonstrating this on for you guys. In this video, I'm going to be using a Barbie doll. So this is my Barbie doll. Okay, so I just entered into the Barbie's vein, my patient's vein. And so now, if you have a saline syringe at the ready, you will need it because the blood will not draw until you flush it. So actually, what we have to do is flush the vacuum first. And the vacuum, if you're wondering what it looks like, it's just this little tube here. And I punch it into that Barbie just so you can see some blood come out. That way I'm able to collect it and show you guys what we have to do. So, actually, never mind, I have my patient right here. So I'm going to enter into my patient's vein. My patient does have a PICC line, but we're not going to be using it today. Now, if you're new here, I'm going to get my saline flush. And I don't know if you can see it here, but I have my flush. And it's going to go right inside the vacuum tainer. And you guys, this is just for demonstrational purposes here. So it'll flush. Now I'm going to get one of my blood tubes. Now that you have a tube on, you can go ahead and pull that sample. The tube will start to fill with blood. And for those of you who are new here again, this is my vacuum tainer. I do a lot of blood draw videos because it's my most interest. Probably going to be a phlebotomist when I'm older. But yeah, I thought I'd just show you what I do here. And so that's basically just, you know, my little syringe, my little, so if you saw the plain vacuum tainer before I added the tube, here is it with the tube on. It's flowing pretty nicely. We've got some pretty good flow here. I'll take the camera, flash it on here. And if you guys didn't know, next we are going to disconnect the tube and attach another tube. and I have my vacuum tube here, and you just apply a little light pressure. You can do sailing, coaxing. There's a bunch of tricks to get the blood to draw. And if your tube doesn't draw, you're either outside of the vein or the vein blew. So next, what we're gonna do is I'm gonna show you blood draw with adding some fluids. Okay guys, this is my bag of fluids, or my syringe of fluids, and I just had to assemble it. And it comes with a cap on it. We're just going to let that tube chill for a minute. And basically, it's just a bigger saline flush. And you're going to insert about 10 mils in there, and then you want to clamp off the line after the blood and whatever you need flows through. Because if you leave the line unclamped, excuse me, you run the risk of, unfortunately, unfortunately not having enough clamping time, and that will run the risk of bleeding. So when it's time to open this, you simply pluck the cap off, and now the lower tip is exposed, so you want to be careful. Whether you're hanging this on an IV line, or if you're just putting it in your vacutainer, regardless, you want to be careful. Now, just for crafts and giggles, that way we can run our vacutainer here. You can probably hear me fumbling around. Right, Grace. What? What was? Shh, I'm recording. So now we are going to, what? So we are now going to take I have a 5 ml syringe here, and we're going to prime our cap. And the way we do that is basically we just pull a little bit of fluid in there and make sure our cap is in fact primed. And so what we use to to do this. It's just a 5-ml syringe and retinol saline, and we put it on the cap, and then we just okay. Oops, I'll get that later. So we're going to take about 10 mils of this fluid and put it in there. But first we need to check the flow of our tube here, because you never know, the tube can stop flowing sometimes. My patient has their arm very straight, so you get very good flow with a straight arm. That's another tip. You can tie a tourniquet if you want to, but I don't recommend it because we tend to lose a little bit of flow here. And I'm just gently shaking the tube in my hand. You don't need to overly shake. Just enough to get a flow. Probably. You can pinch that off. And what we can do here is we're just going to flow that in there. Here's the tubing cap, and it just screws right on. These are plastic test tubes. If you don't have plastic, you will need to be careful. If you drop the sample and pull it open, you're going to have a bloody mess on your floor, and you're also going to have to redraw the sample. Luckily, I was able to collect it successfully. And these are called vacuum tubes. And then, guys, you're just going to let that fluid flow, basically. And this is the IV version of the Vacutainer. And what we have to do here is we take your Vacutainer. This is the Vacutainer. It comes sterilely packaged, needle attached. Leave that needle on there. In another package, you will find the tubing that the vacuum syringe connects to. Attach it, you will have a Vacutainer. Now, because this was just practice, crafts and doodles, I'm going to get my thing to The supplies you'll need for connecting the normal saline flush, got that. 1 sterile latex glove. So you just slide the glove over your hand like so. It may take you a couple minutes to get used to this. However, if it does, don't be ashamed. We all have our errors and we all have our, I'm recording. We all have our references and we all have, our things that we use to attach the glove. Now that you have your glove on, take the normal saline pump in your hand that's gloved, pick it up, and you're actually going to be wanting to check for a blood flash. Actually, I'm going to take my glove off for a sec. So that I can demonstrate something else for you guys. This will provide you with some sterility. While your thing is resting, because this is going into a bloodstream, and if you think you don't want a bloodstream infection, so check that. Now this has a cap. I don't know if you're able to see the cap, but the needle gets protected. So I'm going to re-glove. So we are gonna re-glove here, guys. May take you a couple minutes to get used to putting the gloves on. Practice that before the video would be my recommendation. So you have to shape it to the shape of your arm. Now you may pick up the sterile syringe. When ready, remove the cap and expose the connections. And this glove you're wearing is basically to connect you. And this is just so I can get a blood draw off of her. That's not for the purpose of anything else. And the doctor just ordered some basic normal saline here. So I'm gonna push it in now. Alright guys, ready? I'm gonna untap here. And you are gonna have a chance to see this. Now would be attached to her line. And just because we can, we're going to collect one more sample. And you will repeat the same process, except you will not be hooking up a bag at the end. Because the bag and the one thing you have to be super careful of is not to poke yourself with a needle, which I know can be hard sometimes. But we've got our vacuum here, folks. And I'm pulling. I don't know if you can tell, but I've got blood draw here for my patient. Hi. So this is my patient. Her name is Athena. Okay, now I'm going to show you label and cleanup process. Okay, folks, you are literally just going to take your blood tubes, label them, put them back in here, along with the vacuum cleaner. Now, I'm going to go ahead and put everything away. Thank you guys for watching. As always, have a great day. Thank you. Bye.
Stop recording. Back. Stop recording.